A new initiative at Banner Baywood Medical Center in Mesa looks to reduce the length of stay for hospital patients by assessing mobility needs to ensure proper movement. And here to tell us more is Sean Wine, Associate Director of Rehabilitation Services for Banner Baywood Medical Center. Sean, good to have you here. Thanks for joining.
Thanks for having me.
Mobility initiative. Explain, please.
Yeah, so it initially started as a Banner System initiative in which we take patients that come into our hospital, they're independent. We want to make sure that they leave us independently. That started back in January of 2022, and we kind of expanded the patients that we were looking at mobilizing or walking these patients to increase the amount so that we could better help those patients.
When you did this and initially got this underway, did you notice something? Did this help start this mobility initiative in saying that, wait a minute, these folks are doing better the more they move around?
Yeah, so our initial was looking at those independent patients, and we found that length of stay kind of stayed the same with those patients. Mm-hmm. Out in Banner Baywood, we're in East Mesa, we have a large geriatric population, so we expanded to work with patients that needed just a little bit more help, and we wanted to make sure that those patients were up and walking and moving.
And you have dedicated teams now involved with this?
Yeah, we have a really great group of transporters that help to mobilize our patients. We also have great with our nurses, our respiratory therapists, our physical therapists, occupational therapists. It's all hands on deck approach.
And I would imagine this would allow nurses now to better prioritize other things.
Absolutely, yeah. When we're getting a bunch of the other groups together, it allows the nurses to really just dig in on that patient care aspect.
There's a bedside mobility assessment tool involved. What is that?
Yeah, so the BMAT is what we call it. Originally started out in Baywood. It is now nationally recognized assessment tool, and it's one in which the nurses go and do an assessment on the patient. They're basically looking at how the patient moves when they get in and out of bed. So at the lowest level, they can sit up at the edge of the bed. At the highest level, they get up and they walk around like you and I.
And basically you go from there.
Yeah.
What kind of training is needed for these dedicated teams that are working with these folks?
So our transporters have gotten a little bit extra training on how to mobilize patients, how to keep patients safe, how to avoid falls, things like that.
Yeah, is there more than just a little bit? I mean, is there some serious stuff going on here, some pointed, focused training?
There is some pointed, focused training on how to keep them safe, how to take good steps, how to understand how to use a walker, how to use a gait belt, things like that.
Yeah, yeah. The importance, just in general, of getting people up, older patients in particular, but just in general, getting folks up and moving.
Yeah, it's a huge thing. Those patients that don't get up are at higher risk of pneumonia, skin breakdown, DVTs, occlusive things like that, as well as there's the quality of life piece that we are so used to being up and moving that you lose that a little bit in the hospital.
So you got the complications, and you also, what I'd imagine, have a longer stay in the hospital.
Yeah. We looked at some research and did a study of our own in which we found when we helped these patients that just needed a little bit more help to move, we brought their length of stay down about 2 days. Originally, they were at about 6 days in the hospital. Now we've got it down to 4 days just from getting up and moving.
I was going to ask about the research and what kind of results you've seen from this. That's pretty impressive there.
Yeah.
Reducing numbers of days.
Yeah. We're really proud of it.
So where do you go from here with this program?
That's a great question. We would like to expand it to some of the other patients that are even less mobile than what we've been working with and see if we can help support that as well.
Yeah, and as far as geriatric research is concerned, just in general, is this the kind of stuff where you can send studies and numbers off and have people studying, do research on this?
Absolutely. I think this is a nationwide program that is just probably not talked about as much as it should be.
Yeah. Okay. All right. Sean Wine again, Banner Baywood Medical Center. Get up, move around a little bit, and it helps pretty much all the time, doesn't it?
It does. Yep.
Good to have you here.
All right. Thank you.